Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. Hi, everyone. Welcome back. I'm so excited to be answering your DMs. We love to hear from you. So today, Lacie and I have your questions, and we're going to be answering them later on in the show.
Yes, I love answering questions. I love hearing from you guys.
So how are you doing? How's everything?
Everything's going great.
Yeah.
I'm going to start with my beauty and blemish because you asked me how I'm doing, and I'm just going to start with my blemish.
Okay.
I think I need to go on Spiro again because I am just breaking out nonstop and I hate it.
So you truly have a blemish.
I truly have a personal blemish.
You have a literal blemish.
It's me. Yeah.
Yeah, I love Spironolactone.
I do too.
It works so well for female hormonal acne. I have been on it for 5 years. After I had my second child, I started getting acne. I never even had acne as a teenager. And as an adult, it was so frustrating. And I was getting like these cysts like in my ears.
Oh, yes. Those
so you can get it kind of in that beard distribution. But I love Spironolactone. But some people don't want to take orals.
Yeah.
And so there's a new treatment called Winlevi.
Yes.
Winlevi. That's a topical that works great for hormonal acne. So that's another option if you want to do that. We have some at the office.
No, I was on Spiro before my pregnancy and I loved it. It's like a magic pill.
Well, it does some other things, it's
Yes,
like a water pill. So it gets, you're not as bloated and like you don't have as much fluid retention. It also makes your breasts a little bit fuller.
Yeah.
And because it reduces your oil glands, you're not as shiny and oily. So it does have a lot of, and it also promotes scalp hair, reduces facial hair.
It's like, I saw this and I was like, no, yes, okay.
An excuse to go on it. It's interesting because for a while we were thinking that it had some carcinogenic risks, but a recent study actually looked at that and we think it's negligible. There's really not any greater risk of having cancer if you're on it long term. So of all the pills, on the market, Spironolactone to me seems to be one of the more safe, options for patients.
Yeah. Yeah. So that's my struggle. My beauty is my new necklace. I know you guys probably can't see it, but
I was looking at that earlier and I was like, what does it say?
Remy.
Oh, it's so cute.
Yeah, I love it.
I love that.
My husband got it for me.
Oh, that's such a nice gift.
I love it. It's my new favorite necklace.
Yeah.
I wear it all the time, you guys. Sorry.
Yes. That's awesome.
How about you?
Beautiful.
What's your beauty and blemish?
Well, my beauty was that, I got invited to go speak at the Masters of Aesthetics.
Oh my
it's
gosh.
one of my favorite meetings.
I haven't even talked to you about it yet.
Yeah. So I gave a lecture on my new method for removing tattoos without a laser because I've been so frustrated with laser tattoo removal that there is this new method that is, I think, more organic or actually releases the ink from the skin because there's all this reports now about tattoo ink and safety and whether they have some carcinogenic risks. And when you laser a tattoo, it doesn't actually remove the ink from the skin. It just disperses it and just, makes it go throughout the body. So anyway, I love this new technique that we're working on. And, well, I shouldn't say working on, I mean, it's FDA approved and, we're just sort of fine tuning some of the post-care, but it's been working so well. I was so excited to be able to present it to all my colleagues. And, this is a unique meeting because it's 95% dermatologists. So you're speaking to, all these gurus of skincare, the people that developed all these lasers you hear about, the Moxie, cool sculpting, it's a meeting put on by Harvard and UCSD. And it's just a great crowd. It's a crowd that is, looking for innovative things or, treatments that are on the horizon. So I was so excited to talk about this new method. So I was also a little nervous.
Well, yeah, I would imagine. You're, like you said, around all the gurus in your field.
I
That
know.
would be
And I was like,
intimidating.
oh my gosh, like, what are they going to think about this new method? Are they going to be like, that's, because it's like non-laser, right? And this
Yeah.
is like a huge laser meeting. And so, I guess that was my beauty, that opportunity. But right before I get up on the stage, right, it's this huge room, huge screen, and I get up, I'm going to go to the podium.
No.
So I wore these Gucci boots that I had bought 15 plus years ago. Like when I first finished training, they were one of my first sort of luxury item purchases, like designer purchases. And I love these boots. They're brown. And so I was so excited to wear them. I wore them right before I get on the stage. I looked down and the sole of the boot had fallen off. I don't...
Stop.
I kid you not. I'm going to show a picture of it because I was in shock.
Oh
I was like,
gosh,
the entire sole broke off.
You just walked
and
right
fell
out of the
to the
sole.
ground. I walked up without a sole. My soul left my body right before I gave this huge presentation.
Would have been humiliating.
Yeah, so the head of Harvard Cosmetic Center is up at the podium. He's introducing me, and I'm like, "What the freak is
Did anyone
on?
point it out?
No, but I was like, "How am I gonna?" And they're high boots, right? So high-heeled boots. And so I was like, well, I can do this, break a leg, like hopefully I did like walk up to the stage, go up like a flight of stairs and like go up to the podium.
Oh, wow.
I was so nervous. I could not believe it. I mean, these were Gucci, but I guess they were so old that I lost the soul.
Oh,
so anyway, but it worked out. I didn't fall or trip, but you kind of start that presentation with a little bit of like, even more anxiety. But I got through it and it was very well received. So I was excited. But yeah, now I got to go find a shoemaker.
A shoemaker.
I think I just have to replace the soles of both boots, but I'm not ready to give up these boots. I love them.
You'll have to go back to Greece.
Oh,
Is that where you have
your
sandals made?
Yeah, they actually have these little villages in Italy that the guys sit and they make shoes for you right on the spot. But yeah, so that was my beauty and blemish.
That's actually really funny that you had a shoe story because you made me remember just before we went on break, I left this office after our last recording and I was walking out to my car, and as I'm crossing the street, my foot is like, it almost felt like my shoe was too big, right? And I was wearing flats that zipped up around my ankle. And it was like clunk, clunk, clunk. And then I get to my car and I look down and my shoe had fallen apart. And I was so thankful that it was the end of the day. But
New year, new shoes.
New year, new shoes. I love it.
We're stepping into 2023 with leaving our souls back
leaving
in
our souls
2022.
Behind. I love it. Well, before we get into your guys' questions, don't forget to rate, review, and subscribe to our podcast. And be sure to follow us on Instagram at More Than a Pretty Face Podcast.
Yes, send us DMs. We also do a lot of skincare giveaways on that site. So make sure you follow, and we love to hear from you.
Yes.
Hi guys, it's Dr. Azi here. Love is in the air. Whether you're coupled or not, this Valentine's is the perfect time to give your skin the extra love and care it deserves. So I've got you covered with the Self-Love Bundle that comes with a limited edition leather bag, a pure silk sleep mask, along with a detox face mask and brush. Relieve stress, clear your complexion with detox, formulated with medicated sulfur to treat breakouts, kaolin clay, and charcoal to remove oil and impurities. I personally love doing this mask once a week. I paint it on with a brush, which is very satisfying. I meditate for 10 minutes while it dries and wash it off in the shower. So go check out the Self-Love Bundle at AziMDSkincare.com. That's AziMDSkincare.com. Self-care is the best form of self-love.
First up, we have a question from Helene G. And she is a provider that also does microneedling treatments. And she's curious if the positioning of the patient's head has an effect on the outcome of the procedure. For example, she sees some people do them while the patient's laying down, and some people perform the procedure while they're sitting up.
Yeah, that's a great question. I think the operator, the person that's doing the procedure, that comes with time and experience to figure out what position works best for you. Mm-hmm. I find that, having the patient's skin at a 90-degree angle to your hand is the best position. And so you'll have to, kind of play around with the tables. I don't inject anyone in a completely straight. Now, when I am doing fillers and things, I will always mark the patient in an upright position, kind of in a natural state. I first mark them in that state, and then I may lie them back slightly. But still, once you lie people flat, their anatomy can change. But with microneedling, it doesn't really matter. You just want to make sure that the microneedling pen, the device, is at a 90-degree angle to the skin. Because especially with microneedling, if you're a little bit at an angle either way, you can actually tear the skin and get some scarring that way. We've seen that happen. So you have to be really careful with your positioning. And that just comes with time and experience, trying to figure out, at what position can you achieve that 90-degree angle the best.
Yeah. For me, I personally like them laying down because I feel like I have more control over the pin.
Right. Yeah. And that depends on where you put your hand, because you always have to think too, if the patient moves, you got to be able to move with them.
Right.
Right. And that's a little harder to do when they're upright than when they're lying down.
Yeah. But that's a great question.
Yeah.
Yeah. All right. The next one is from SD Beauty and Aesthetics. And they write, "Hey, Dr. Azi, I'd be interested in knowing what risk factors are considered for patients who receive neurotoxins."
Well, the biggest thing is, myasthenia gravis, anybody with a risk for that. Some patients I find are just at higher risk for developing ptosis. For whatever reason, we don't know exactly the mechanism for ptosis. We think that there is, some sort of channel that goes from the glabellar complex down to the eyelid muscles that may, increase the chances of ptosis in some more than others, particularly on the right side of the patient. Now, the main risk with neurotoxins, and when we say neurotoxins, we mean things like Botox, Dysport, Xeomin, Jeuveau, and now this latest one that's coming on the market is Daxxify. But these are injectables that interfere with the muscle talking to the nerve, and therefore relaxes the muscles that cause the skin to crinkle and wrinkle. So when you do a neurotoxin injection, you can't wrinkle the skin, and therefore you can smooth the skin, treat wrinkles, but you can also lift, the brows and so forth. But getting back to your question, the most common risk is really just bruising, because anytime you have a needle enter the skin, and diffusion of the neurotoxin to muscles you don't want to knock out, right? You want to be as precise as possible. And so the potential worrisome outcome is the ptosis, which is when people can't open their eyelid. But that's pretty rare, and the general population is about 1 in 100. There are techniques and ways that you can minimize that risk even further as an injector, and that would be, the depth of the injection, the concentration of the product you're using, putting your thumb. I always put my thumb at where the veins and the nerves come out of the foramens in the glabellar complex. So those are ways that you can minimize it.
And the good news is ptosis is temporary.
Yeah, that's true.
That's good. Yeah. If you do get it.
Yeah, and you can use drops like Upneek to help with that, but it usually goes away within a few weeks.
Great question. Yeah. All right. We have one from Glamis Gypsy. And she said her 13-year-old son started battling blackheads and acne, visible on the chin, nose, and ears. He has been using salicylic acid pads and when swollen red spot treatment. I'm not sure what that means. Is he too young to have facial extractions? And would it make it worse or help gain control?
Yeah, so that's a good question. I mean, so we have inflammatory acne, which is like the red, juicy pimples. Extractions do not help with that. Now, blackheads, they are just, clogged pores. You can see it's an open comedone. You can see there's like the black stuff inside is like cement. It's like stuck in there. And salicylic acid is great for that because it helps dissolve that gunk, the keratin and, debris that gets stuck in the pore. It takes a little while. It takes about 4 to 6 weeks, sometimes up to 3 months to really improve that. The extractions help blackheads, but they're not going to do anything for the inflammatory acne. If anything, extractions can make inflammatory acne worse. So if you're gone from having just blackheads and whiteheads to inflammation, then you may need an oral treatment if the acne is deep. You can always add on a retinol like Differin. I love Differin for inflammatory acne and for blackheads and whiteheads. You can apply that at night and the salicylic acid pads in the morning, but make sure he's also moisturizing, because that's one thing that people don't realize is acne is a disease of the skin barrier. And when the skin barrier is compromised, as it is in acne, a lot of times people don't moisturize thinking, it's going to make my blackheads worse. It's going to make my acne worse.
Especially boys
who are not used to putting anything on their face. Wrong. And you're already using, salicylic acid and retinoids. These are kind of, strong topicals. So make sure that you're also moisturizing and supporting that skin barrier when you are experiencing acne. But I don't think, getting back to your question, I don't think 13 is too young. You can certainly extract the blackheads. That's usually how acne starts, but that would not be my first line of treatment for him. It sounds like his acne is now, progressed to having, inflammatory, maybe even, cystic, if he's getting a lot of swelling, he's got a lot of inflammation. So it sounds like he needs more of a professional evaluation and change in his regimen.
Yeah. At what point is the Diamond Glow facial, like, at what point of their acne would it not be okay to do the Diamond Glow? Well, I think,
if you have a lot of inflammation, again, you don't want to be doing, facials to treat it. You really need to control the inflammation because, again, acne can start out with blackheads and whiteheads and not a lot of redness or swelling. But then if it progresses to, these red, juicy, painful cysts and papules, then you need medicated topicals. Sometimes you need orals to gain control of the situation quickly. We have amazing treatments now for acne. So it's a good time to have acne because we have so much we can do for it.
Yes. Our next question is from Melody H. And she said, "Hey there, love the pod. I'm an esthetician at a med spa and thinking about getting the AviClear device for acne. With your expert advice, would you think that this is a reasonable treatment option for acne? Some are saying that it's even replacing Accutane. I don't know.
Yeah, I'm excited about it because we definitely need a device that comes, as close to Accutane as possible, because Accutane is a miracle drug, right? We can guarantee clear people on it, but not everybody wants to go on it. There's a lot of potential side effects. You have to come in once a month and so forth. So the AviClear has a lot of promise, but it's so new.
What is it?
So it's a laser that targets the oil glands, the sebaceous unit, and essentially similar to acne, destroys it or minimizes it, or, reduces it. And so it is showing a lot of promise, but it's so new. Sometimes, I've seen this come and go. We've had so many devices come on the market and say, this is it. This laser is going to clear acne, and it's going to be, the next best thing. It's going to replace Accutane. And then a year or 2 later, we realize, it's not as,
not really,
as great as we thought it was going to be. So it's still new. But I do have some colleagues that have it, and they say that after 5 or 6 treatments, they're seeing really amazing results, which is similar to Accutane, but it is painful. A lot of kids have a hard time with the pain and intensity of the device. So we'll see. I think anytime there's something new, I'm not the first one that wants to jump on and, purchase it or bring it into the office. I like to give it a little bit of time, but it definitely is showing a lot of promise. I'm super excited about it.
Aw. Well, our last question is from Sarah, and she said, what is buccal fat treatment?
Buccal fat removal. Yeah, that is trending now. And that's when people go in and you have a round face and you want more of a sculpted, sort of more definition to the face. You get the fat taken out of the mid cheek here and gives you more sort of a more definition.
Interesting.
But I'm not a fan of this procedure. I think there are very few people that are good candidates, and it's highly, highly technique dependent. So you have to take just the right amount, just the right way to get the desired outcome. Plus, what happens as you age, you lose that fat.
Yeah.
So when you age, you might be like, oh, well, I wish I wouldn't have had that done, because it happens naturally as you age. And then here you are trying to correct it. And maybe, there's some scar tissue that can happen that could further contract that area. So it's a tricky one. And I would be very, very cautious and go see a few different people, get a good evaluation, look at the pros and cons. And if it's something that you absolutely want to do, then, I'm not going to argue, I'm not one to say don't do it, but it is one of those things that you might regret later on, like when you're in your 30s and your 40s and that buccal fat goes away just naturally. You might wish that you wouldn't have done that.
What's that saying?
I think Christy Teigen had it done.
On the face or fat on the...
Fat on the face. It's either the French always say either your face or your butt. Because as you age, we lose collagen, we lose elastin, you lose fat, which fat is a huge, factor in keeping us looking youthful and, younger. And so I want to keep as much of my fat on my face as possible. Personally.
I love that.
Well, thanks guys for tuning in. I hope that was helpful. If you guys find this valuable, share this with a friend, and don't forget to rate, review, and subscribe.
Yes.
Until next time.
Bye.
Bye guys.